Alright, so last we're going to talk about the lower extremity, starting with the pelvic girdle. Pelvic girdle is made up of 2 hip bones, and each hip bone or coxal bone is made up of 3 different bones. This top piece here, which is like a wing, is called the ilium. The bottom piece here is called the ischium, and then this front piece in the middle is going to be called the pubic bone. So if I have 2 pieces here, which should look something like this, okay, and it articulates with the sacrum, which is the bottom half of the vertebrae. It'll articulate like this, forming a circle. Okay, this joint that I'm forming in the back with the sacrum and the ilium is called the sacroiliac joint. It helps us walk. Okay, so how you identify this, if you were just giving this bone on an exam, is you would pick it up, look for this indentation, which is called the acetabulum, and you would look for the greater sciatic notch, which is where your sciatic nerve is going to go. This will always be lateral, so it's facing away from the body, and this is posterior or behind the body. So I can tell that this is my left and this is my right. This is going to become important for us because if I ask you a specific area on here, you want to be able to recognize the 3 bones. So what you need to know for the pelvic bone is the acetabulum here. This structure is called the ischial tuberosity. It's what you sit on. And then this forms something called the pubic symphysis. That's how the 2 pelvic bones connect. Then you're going to get to the next piece, which is the femur. Now the femur has a really big femoral head, and that inserts right into the acetabulum quite nicely. It also has a neck, okay, which kind of looks pretty good next to the head. It has this top piece here, which is called the greater trochanter. You can actually feel that if you rotate your hip in and out. And then on the posterior aspect, you see the lesser tuberosity. Now, again, how I can identify this as being the right versus the left is you look for the head to be medial, and then you're looking for this notch to be posterior, just like we did with the humerus. So I know that this is my right femur. Okay. Looking at the bottom of it, you have the medial condyle, and you have to tell me medial or lateral, so pay attention to where the head is. This is the medial condyle. This is the lateral condyle. And then if you feel the outside of your knee, you'll feel the lateral epicondyle and medial epicondyle. Epi just means it's smaller. Okay? It articulates with the tibia. So I'll go to the tibia now. The tibia takes on all the weight of the femur. This guy on the outside here is called your fibula. He doesn't do any weight bearing at all. He's just there for muscle attachment. But you can tell again if these 2 are together, which one's medial or if it's right or left, because the fibula is always lateral, has an L in it. These guys up on the top are called the medial and lateral condyles. This knob here in the front is called the tibial tuberosity. And if you go to the medial side of the tibia is the medial malleolus. The fibula has the fibular head, which is partly destroyed here. And on the bottom is the lateral malleolus. Okay? The only extra little guy that we have for the lower extremity is the patella. You just know who that is. Okay? The lower half, or the foot, is made up of the tarsal bones, which are all these little small bones here underneath. The sole of the foot, or the arch of the foot, is made up of metatarsals, and then just beyond that are the phalanges.